Hello and welcome to On the Clock, presented by WorkStream. If you care about hiring and retaining hourly employees, you're in the right place. I'm Daniel Blazer, and today I'm clocking in with Bryce Porter, Chief Strategy Officer at Covenant Care. Covenant Care operates 29 skilled nursing and home health care locations with more than 5,000 total employees. We discuss the unique hiring and retention challenges faced by the healthcare industry, why operational efficiency is essential when hiring, high-impact retention strategies, and more. Your Chief Strategy Officer, I'd love to hear what that role entails and maybe some of the biggest challenges that you're facing in your position.
Yeah, we've got this particular role is kind of a hybrid between operations and business development. So it's looking at opportunities that we can modernize some of the processes that we use in our census development, kind of increase the sophistication of our communication and how we reach our target audience. And then also just coupling that with the operations. It's been, since the pandemic, it's been really challenging and complicated figuring out the right balance as we have a staffing crisis. 250,000 healthcare workers have left the industry in the last 3 years. And so being able to still manage the same staffing ratios that we need to have, but at the same time finding talent that we can recruit to the industry because there's not enough in the industry to supply the demand. So it's just being able to balance those two areas, and that's what my focus has been.
Why is operational efficiency, which is I think it's something that you really care about, why is that so important when it comes to hiring and retaining the right people?
Yeah, well, a majority of our workforce is frontline caretakers. And so obviously a lot of nurses, CNAs, therapists, and then all of the supporting roles to care for the patients in the facilities. And so it's knowing that labor is just such a tremendous majority of our expense. We've had to supplement any of our regular staffing with registry staffing, and that comes at a cost that's 2 or 3 times what the normal rates are. So we're not getting most of our business, largely over 95% of our business is all using taxpayer dollars. So it comes from either Medicare or Medicaid. And so none of those rates went up by 2 or 3 times relative to the rate of increase on our expenses. The cost for PPE and everything else. I mean, we just literally within the last few weeks, within the last 30 days in California at least, we aren't required to wear masks any longer. And so you think most of the world kind of got back to normal maybe a year and a half, ago, maybe a year ago. Whereas in the healthcare industry, we were still had the same regulations pretty much up until the last 30 days. And so there's a lot of expense that comes along with that, providing all the PPE to be in compliance with what those requirements are at the time. So that's there's a lot of complexity to try to figure out. When our revenue isn't on pace with our expenses, it's how can we be more lean in other areas, and how can we try to grow our business and be really make sure we don't let anything fall through the cracks.
I would love to hear, you're talking about the tremendous challenge faced by your industry specifically right now, just not having enough applicants. Obviously, pay is kind of the most important thing when it comes to attracting employees, but what sort of perks or other benefits have you found make a real positive impact when it comes to attracting applicants?
Yeah, benefits are a big deal. People want to be sure. I mean, healthcare benefits, proximity to where they live, but probably the most important ones that always play into the calculus is do they have a friend at work? Do they feel valued? Do they feel respected? Do they have the tools to do their job? Do they feel like there's opportunities to learn and grow? And so those are things that we can control. We can't control always some of the others. And so those creating a workplace that that develops our people and gives people opportunities to grow is really something that we believe we can be better at and provide ourselves with a different kind of a point of differentiation from other providers out there.
One other question that I have, you mentioned that some of your team does home health care, correct? Have you found that to be a challenge when you talk about like helping employees feel connected to their employer and feel like they have a friend, they have a support system? What sort of challenges do you face that are kind of unique when you're dealing with like a home health care provider that maybe they're not in the same location every day, or there's kind of not that home base, I guess?
Yeah, in healthcare, I mean, we're trying to get back to, or what we try to tie into is the intrinsic value that they had for an individual to get in the healthcare industry in the first place. So if you're a nurse, if you're a caretaker, if you're a CNA, if you're a therapist, you did it because you've got that's important to you. You put value in being able to help others that, when they can't help themselves. Most of the world figured out how to do a lot of work remotely just because we were forced to. Unfortunately, you can't take care of patients remotely. So if they can't take care of themselves and they're bed bound or wheelchair bound, they can't give themselves physical therapy. They can't take themselves to the shower or feed themselves or clean themselves. And so it required us, like, it really didn't change any of our obligations from a day-to-day basis, but we just had to do it in different parameters and in ways that we were understood to mitigate any spread or any risk to increased risk to any residents. And so for us, it's being able to look at the opportunity and see how we can pivot and still be successful, still be an attractive employer, and reconnect people as we get back to doing the things that are normal. So, for example, for the better part of at least 2 years, one thing that people don't really think about is the social element of the residents. So, for example, for 2 years they couldn't go to the dining room. So you have patients that largely are bed bound or wheelchair bound. They were not allowed to come out of their room in a social setting. So they weren't going to participate in activities. They weren't regularly dining with others because they were trying to limit risk and spread. And so a lot of places were very limited for at least a year, if not 2, on visitation. So loved ones, family members, guests. My own father's in a skilled nursing facility in Las Vegas. And for at least 2 years during the pandemic, we weren't able to visit him at all. We were only able to communicate him by, through Zoom or FaceTime. And so there's a lot of kind of emotional toll that takes, but also from a staffing perspective, it's kind of getting back to your question, is, the rate of turnover in the industry is so high that you get to a point 3 years in that there's maybe half of the people that work in a facility, say you have 100 employees, half of them have worked there and they've never actually worked there while guests or visitors have been there. And so that's a really interesting dynamic for people to get back to and get used to dressing people, grooming them, getting them up and in their wheelchairs, getting them off to activities, helping them back into dining rooms. And that's something that was an adjustment at first. Most people were like, oh yeah, I forgot this is what we used to do because it had been so long. So that's a big part of what we're trying to get back to so that at least the experience that the patients have is different than what it had been the last 3 years.
What advice or recommendations would you give to the people listening to this podcast about, when it comes to hiring, retention, some of those things that might interest them? Like what sort of unique perspectives or learnings do you have?
Yeah, so as it comes to like the recruiting side of things, what we've learned a lot, at least in our geography, is that there's especially in healthcare, they have so many options, and so it's most of these folks are working at least 1 or 2 jobs, and so they don't have a lot of time. They don't have a lot of disposable time, so they're kind of either working double shifts. they're working time and a half, they're picking up extra shifts, or working at another job. And so the people have been very price sensitive where there's been opportunities. For example, if you've been desperate, in order to keep your staffing, compliance with your regulations, you've been willing to pay a lot more than you ever would have in the past. It creates an interesting dynamic because you're bringing in new team members that are potentially at higher wages than those that have been there much, much longer. And but it's because you're so desperate and you don't have any other options. And so how do you still do things from an employee appreciation perspective? How do you find the funds to at least be fair to those that have been there and raise them so that they're on par, and still keep them engaged and establish that loyalty? I don't know that we have like the secret sauce on that. I think we've done as good as we could to make sure that we've done a wage analysis, and so that we're fair with what we do, and that we're careful not to bring in people at higher wages, even though it could be, it's pretty tempting when you're really desperate. The other part of it is people aren't exploring job opportunities. They don't take a long time to make a decision. So for example, we might place an ad for a registered nurse or a treatment nurse, and you'll get maybe a half dozen applicants, and if you wait even an hour or two to contact them, heaven forbid even the end of the same day, they've already accepted another job somewhere else. And so it's the early bird gets the worm more so now than ever when it comes to candidates. They're making quick decisions. They're getting the applicants have a lot of leverage and a lot of opportunity to get whatever they want in a lot of cases. And so for us, it's how can we connect with those applicants as fast as possible in a meaningful way, start that engagement, and have both of us have the opportunity to evaluate the opportunity as quick as possible, so people can make informed decisions, and we have the best opportunity at hiring them.
Great recommendations and advice. Thank you so much, Bryce, for sharing your perspective and a little bit more about Covenant Care. I really appreciate it.
Yeah, happy to share.
Thank you for listening to On the Clock. For more info, visit workstream.us/podcast. I've also included a link in the show notes to connect with Bryce on LinkedIn. Until next time, we're clocking out.